everyone. It gives me immense pleasure to welcome you all on this special expert speaker program by 4Life India. Today, we are focusing on urinary system health. And for this, let me introduce you to our esteemed guest speaker for today, Ms. Shobha Shastry. And she is a renowned nutritionist with a master's degree in foods and nutrition and wealth of experience in the nutraceutical and nutrition industry. She has also has a wealth of experience in medical communications and has also been featured on national television on topics like health and nutrition. Thank you, Shobha, for to be a part of this session today, and we are truly happy to have you with us.
Thank you, Shweta. The pleasure is mine, and I'm looking forward to our conversation.
Superb. So let's dive into the discussion. So my first question to you is, can you provide some insights into the increasing prevalence of urinary system health and why it has become such a concern?
So true, Shweta. So if we look at it globally, 2.2 million new cases of kidney-related health challenges are occurring annually. And what has been the point of contention is a recent ICMR report where 1 in 4 women and 1 in 10 men seem to have repeated urinary tract infections. Now, you may think, why is that the case? So there are certain factors which the reason lies in our diet and lifestyle, which is contributing to this. So these factors include, having a diet which is very high in salt, very high in sugar, or being prone to having high blood sugar, high blood pressure, which are stressors on the kidney, and stress. So all of these are the factors which have come to this point where we are looking at men and women having recurrent UTI. So we should be looking at urinary tract health, as you mentioned.
So the statistics are indeed very alarming, and I think a lot of people are getting affected by it. So could you share what types of lifestyle interventions do you suggest for people with urinary system health challenges?
So, Shweta, first up, very simple, as you mentioned, thing that any one of us can do is to drink a lot of water to improve our hydration. Because also in this stress of everyday life, people skim or skip on drinking water completely. So hydration is important. Apart from that, holistic care, because prevention is much better than, going through the treatment. So holistic care is very important. So stress relieving techniques, also, keeping away from processed foods, high salt, high sugar, oily, fried foods. These are some things that one can do from their end. And physical activity. It is good for overall health and also for your kidney and urinary tract health. But apart from that, good hygiene. So this could mean wearing breathable cotton innerwear, never holding on to urine, be it men or women, voiding your bladder. And if at all one has to use a public washroom, they could hover for the time being, but ensure that you come home and void, because doing so you don't completely empty out your bladder. So come home and empty out. So that is some things that one can look forward to.
Very important. Okay. So we have discussed about lifestyle intervention. So can you share some dietary changes or tips that can support managing urinary tract health?
Definitely. So another thing that contributes, so apart from whatever I've spoken, is obesity. So even, carrying an extra body weight can also impact. So overall, so we may think, where is your urinary tract? And so what if I have blood sugar? Or so what if I have high blood pressure? But they all impact the kidney also. So anything that impacts your overall health, even including gut health, impacts your kidney and your urinary tract health. So simple dietary changes would be to include anti-inflammatory and high antioxidant foods. So these could be things like berries, your blueberry, your cranberry, whole foods, whole grain foods. These are very important. And enough water. So again, we'll talk about a lot of water. Probiotics from foods such as Greek yogurt, fermented sauerkraut, or that kimchi, which you get easily nowadays. So those things are excellent. Out of the foods that has to be limited, we can try limiting spicy, oily, fried, so high salt, sometimes alcohol and caffeine, and even artificial sweeteners are bad. So as much as possible, we try to stay away from that. Yes, we try to stay away from that. Yeah.
Okay, so these alcohol and caffeine, they tend to act like triggers, right?
Exactly. Because many people are very sensitive to that. Yes.
That okay.
Yeah.
So that's quite insightful, Shobha. So as you said that 1 in 10 men and 1 in 4 women, they are suffering from UTIs, and these are often not openly discussed, but they can definitely cause a significant discomfort. So can you share some ways we can manage UTIs effectively?
Exactly. So, as you correctly pointed out, it is not something that people openly discuss. Oh, it's a little bit of uncomfortable. There's some burning sensation while urination. Nikal jayega. Maybe if I drink a lot of water, it will go away. But the first step is to openly identify that there is a problem. And yes, drinking water does help. So, level one, everyone, whoever is facing this kind of discomfort, to drink a lot of water because that flushes out the bacteria, the toxins, anything that can cause the UTI. Secondly, active infection, if nothing is moving and nothing is resolving, best to go to a doctor and consult. Um, and apart from that, dietary changes immediately to put in our, stop eating anything from outside, opt for only home cooked foods. And as I mentioned, try including these berries in the diet, try including fiber rich foods, whole grain foods, dark green leafy vegetables. So improve your diet, drink a lot of water. And if there is still not much of improvement, then going to the doctor is the best way out.
So we have discussed about the urinary tract health. So Shobha, let's move on to the bladder health. Now, what about bladder health? Can you share some tips for maintaining the bladder health? Because it's a very important part of the urinary system.
Exactly. So now bladder, as you correctly mentioned, kidneys, still there is some importance given. Bladder, people generally forget until and unless age catches up, and then there is things like incontinence or, leakage and other things happening. So what we should
Yes.
do is we work out. So we should work the bladder. We should do some workout for the bladder also. So one of the important things that one can do, and I'm sure which you will also agree, is the Kegels exercise, which
Yes.
is the rhythmic holding, contracting and releasing. So, you contract for a few seconds and you release it. Just as so you have one has to do this when they are not urinating. So what the
Okay.
contracting should feel like how you hold your urine back and then you leave it.
Mhm.
So this anyone can do sitting at office, traveling, even now as we are watching the podcast now, we can do that as well. So, that is a very simple, easy to do exercise everyone should do. And apart from that, limiting some foods, like some people are very sensitive to caffeine, alcohol, artificial sweeteners. These are also problematic things. So limiting that helps a lot. So exercises, limiting trigger foods, as you mentioned, and drinking enough water. So these should usually take care of any bladder or prevent any bladder issues.
And what about pelvic floor exercises? Are they also effective in maintaining your bladder health?
Exactly, exactly. So Kegels is one part of the pelvic floor exercise and ideally recommended for post-pregnancy, even aging, post-menopause or even
Yes, yes,
andropause. So
exactly.
it's better to maintain the muscle tone. So it helps in maintaining that muscle tone, which helps
Muscle
in
tone.
holding back our preventing the leakage and incontinence that might happen. So that kind of exercise helps a lot.
Okay, so for toning the bladder, it is very important to do pelvic floor exercise and kegels, right?
Exactly, exactly,
So I think
100%.
that's a great advice. I think all of our viewers should go ahead and watch on YouTube and check out how to do these exercises. I think very, very important, and they can play a very major role in maintaining your bladder health as you age. So, Shobha, as you know, I would also like to ask you, we have discussed about the lifestyle interventions, we have discussed about diet interventions, what can one do for managing good bladder and urinary system health. Now let's move on to supplements. Like alongside diet for people who want to improve their urinary system health, what are some of the supplements that you offer recommend to the clients that come to you or the people that you see on a daily basis?
Yes. So the best part about supplements in this category, Shweta, is that it's mostly derived from food. So food-based supplements are the most effective than chemical-based. And if you look at the ingredients of what constitutes an ideal urinary health supplement, it should have the berry extract. So ideally cranberry extract, blueberry extract, these are proven to help prevent, even resolve urinary tract infections actually. And apart from
Okay.
that, some other ingredients such as D-mannose is also shown to be very effective. So there are some studies regarding all of this. This is very targeted to urinary health. Apart from that, gut health also, which is very close to your urinary system, gut health, maintaining that. So eating foods, again, as I mentioned, fiber rich, probiotic rich, having magnesium, having vitamin B6 takes care of the entire gut and the urinary health ecosystem that is going on there. So healthy flora in the gut, antioxidant with cranberry extract and blueberry extract for the urinary system. These are what I usually recommend if I have to recommend some supplements for people who are having recurrent UTIs to prevent it when they, especially when they are traveling or something like that coming up. So this is something that I ensure that I recommend.
So Shobha, throughout this conversation, you have been mentioning about cranberries and blueberries and other berries, which is very important for the urinary system health. And I think a lot of supplements in the market today are having these ingredients when it comes to urinary system health. And the best part is in 4Life, we have a targeted supplement, a supplement from the targeted category called as 4Life Transfer Factor KBU. So the supplement, when you see, it is a very holistic approach. So it is providing, as you said, that food-based supplements are very effective. So we have this KBU, which is a food-based supplement, and it has extracts from cranberries. It has it's a unique formula. Basically, it will support the kidney, the bladder, and the urinary tract. So that is why the name comes from the KBU. So when you look at the ingredients, it has cranberries and blueberries for antioxidants. And as you know, you must be knowing that antioxidants have proanthocyanidins in them, which are very effective at managing, at reducing the inflammation and, quenching any kind of free radicals that are there, which are one of the reasons for the inflammation in the body. So we have highest quantity and quality of antioxidants in it from cranberry and blueberry extracts. Then we have dandelion leaf, which is for the natural detox and balance. Then we also have juniper berry for cleansing support, and we have Bhumia malaki, a traditional herb for kidney health. Apart from this, as you mentioned, that D-mannose is one of the very good ingredients when it comes to managing the urinary system health. We also have D-mannose. And when you look at the qualities of D-mannose, the best part is it cannot be ingested by the human. So it will come out of your body within 30 minutes. And the best part is it is going to attract all the harmful bacteria and it is going to take it off from your body. Okay. Then it has IP6 for urinary tract protection and balance. And it is infused with patented 4Life transfer factor, tri-factor formula, which is amazing for your immunity. So what do you, so Shobha, when you look at the formula, what do you think about immunity enhancing or immunity balancing ingredient in a product like KBU? What is the importance, and can you just brief our viewers about it?
So the best part that I notice about 4Life ingredients is the transfer factor, which is there in almost all the formulations. So
Yes.
it takes care of your overall, your systemic immunity, the overall holistic immunity.
Yes,
And
yes.
then the targeted or local immunity is where you come, where the cranberry extract, as I mentioned. So this is a very good formulation in that way because it is taking care of your systemic immunity. Because somewhere our bodies also play a role, our immune system also plays a role in identifying and preventing repeated attacks. And local systemic area, how does it prevent the addition of, or attraction and addition of all these bacteria? So it's a very good combination of both is what I have noticed, and it's a very very interesting. I'm definitely going to recommend this to some of my patients now, especially the ones who, yeah.
Okay.
Yeah.
So
it's
it
a
is
very good.
actually it has been loved by a lot of people because people who are traveling frequently or people who have already have history of kidney related health challenges or bladder related health challenges or for that matter urinary tract health challenges. So for the entire system, this is a targeted product, not only for one organ, it is for the entire system, and the ingredients are coming from food. So it's a food based supplement plus addition of transfer factors is like you can say like cherry on top. So this is one of the best products that we have from the targeted category.
Got it. It's a very good formulation. I can see that. Yeah.
So, Shobha, before we end the session, I would like to have some key takeaway from your side for maintaining the urinary system health overall and for our viewers so that they can take this message and maintain their urinary system health.
Sure. So one thing is hydration is very important. If I have to put it as a pillar biggest pillar is hydration for urinary system health, and give enough water for formation of urine and flushing of the toxins. So hydration is one. Good food, antioxidant rich, fiber rich, probiotics rich food is very important. Lifestyle, you start working out your entire body, start working out your pelvic floor. So Kegel's exercise is again important. The fourth and the final pillar is supplements. So when you're not able to get that much kind of food, you can take these supplements, especially the 4Life one is very promising with the cranberry extract and D-mannose. So that is the four pillars on which I would say I would like to leave it with. The four key pillars are these.
Superb, Shobha, superb. Thank you very much for these wonderful insights. And we are really happy to have you once again on the session and looking forward to more such sessions with you. Thank you so much for sharing these valuable insights. And I'm sure our viewers will find them incredibly helpful. So, what are your views on the session for today? Please let us know in the comment box, and also let us know which kind of topics would you like us to cover in future. So thank you very much, everyone, for attending today's session. And we are really happy to have you. Please comment, share, and like to this session. Thank you very much, everyone. Thank you, Shobha, for being with us today. Thank you so much.
Thank you so much, Shweta. Thank you.
Bye.